Bad breath, or halitosis. Now, we all know it's a terrible thing, but I suppose it's better than no breath at all. That's the best thing you can say for it. What's the cause of it? What can we do about it? And how do you know you have it? Well, a lot of people are blissfully unaware that they have bad breath. One way to test is to lick the inside of your wrist and then sniff it. And if it has a bad odour, then it's very likely that you have bad breath and you need to do something about it. Otherwise, your best friends are going to tell you, or strangers are going to recoil in horror as you speak to them. So, what's the cause? Well, there are hundreds of causes of bad breath. The commonest would affect the mouth. So, for example, if you've got any kind of dental caries, if you've got any food residues between the teeth, if you've got any gum disease, if you have a very furry tongue, then those are common causes of bad breath. Equally, at the back of the mouth where you've got the tonsils, some people have chronically inflamed tonsils, or they have the effects of inflamed tonsils in the past with crypts, little holes in the surface of the tonsils into which food debris and bacteria can collect. Reflux disease, so the acid coming up from the stomach, you might not even be aware of that. It can happen during the night, and that's a potent cause of halitosis as well. Then there are dietary factors, things you've eaten, garlic, curries, other spicy foods, alcohol of course, smoking, all these things can have an effect on the breath. And just as alcohol is absorbed from the stomach and excreted in the lungs, in your breath, so are some of these other substances. So there are dietary things. And another common cause is dehydration. People often don't realise that as they get very dehydrated, they're more at risk of having bad breath. And finally, people on a high protein diet, which is popular these days and not unhealthy, you can generate the degradation of fats in the body, the breakdown of fats for energy when you're not taking any carbohydrates. And those substances are called ketones, and they have this characteristic sweet smell that it gives to the breath, and that's called ketosis. And that can be picked up in someone who's exercising very hard and who hasn't eaten, or in people who are on a high protein diet, the sort of caveman diet. So think about the diet that you're on and adjust the diet. And to remedy bad breath, start with the mouth. So brush your teeth regularly and floss between the teeth to remove any food residues. Use a tongue cleaner to clean your tongue, especially if it's very furry. Use a mouthwash to gargle with. That really helps if you've got trouble around the tonsil area in the back of the throat, or any nasal congestion. If you've got reflux disease, then you can take an antacid to deal with that. And then if it's still a problem, go and talk to your doctor, because there can sometimes be a serious cause for bad breath that needs further investigation. So deal with it yourself with antibacterial mouthwashes, which also kill the sulfurous compounds, which are particularly bad in producing the smell of halitosis. But go and see your doctor if you think that it's something that you can't get under control yourself. As I say, it's a social problem, but sometimes it can be a medical one too.